My name is Felicia, and I chose to cover the rotator cuff strains in college softball players. The rotator cuff surrounds the shoulder joint, keeping the head of your upper arm bone firmly within the shallow socket of the shoulder. It involves four muscles, including the supraspinatus, which elevates the shoulder, the infraspinatus, which externally rotates the shoulder, along with the teres minor, and your subscapularis, which allows the humerus to move freely during elevation. Some symptoms of rotator cuff injury strains would include patients with chronic injury of the rotator cuff will often have pain that develops over time. You could have pain at rest or at night. The location of the pain is often variable, but may also radiate to the elbow. And then your pain is generally worse with reaching motions, especially overhead, such as in softball. Some risk factors would include repetitive overhead use of the arm, previous injury, improper throwing techniques, and shoulder muscle imbalances. The older the athletes get, the more likely they are to get the injury as well. Some of the risk factors, repetitive throwing motions, such as in the late cocking or the acceleration phase, immediately prior to throwing a ball. Your arm is lifted away from your body, and this externally rotates your arm, causing compression of the rotator cuff muscles. And then during the deceleration phase, your shoulder experiences some type of distraction forces that can lead to tensile strength failure of the rotator cuff muscles. Along with SIC, which is scapular malposition, inferior medial border prominence, and coracoid pain, and dyskinesis of scapula. This is often associated with shoulder injuries, including rotator cuff injuries, and overhead throwing athletes are more prone to this. Previous injury, so this puts your shoulder in a more vulnerable position to begin with, which could more easily lead to injury. And then your shoulder muscle imbalance. If the muscles are imbalanced in strength, the athletes may use one muscle far more often, causing the other one to be decreased in strength. And measurements taken from the NCAA Women's Softball Injuries Report, the most common area injured was the shoulder, which was at 15.2%, which involves the rotator cuff injuries. And to reduce the impacts, one would need to do proper technique, making sure that's observed even at the beginning of practice, all the way to the end whenever they're more tired. You need to exercise all the muscle groups in your shoulder, because exercising only one or the other, it's going to make the other ones weaker. You need to help prevent the humerus head from slipping out of the socket, which will reduce the risk of rotator cuff injuries. And then strengthening exercises that emphasize equal conditioning of both muscle groups. And these are my references.